My name is Eric Kelly. I serve as Regional Vice President of Allegany Franciscan Ministries. We are a Catholic organization. We're a public charity, but we function as a grant-making foundation, and we fund in the area of healthcare access. The Franciscan Sisters of Allegany, when they began to divest their financial interest from acute systems here in this region, created this foundation. And we, our foundation, follow in the vision and the tradition of the Franciscan Sisters of Allegany. Our focus is to improve access to health care. But when we talk about health care, we talk about the quality of care. And our indicator of quality is around cultural and linguistic services that are appropriate for all people. So while we do not fund direct medical care or health care, we fund in what we call a theory of change, improving the competencies of providers. For instance, we believe that health care providers who are in tune with the person who presents, their set of values, beliefs, norms, traditions, their understanding of the process of disease, when providers have an understanding of the culture of an individual, and when those individuals from diverse cultures and backgrounds have an understanding of the system and are health literate, we believe that the encounter is improved. So when we talk about access to quality care or culturally competent health care, we believe there's responsibility on the system side, but we also believe that there's responsibility on the personal side. And so all of our funding for the last 5 years under this strategy of improving access to culturally competent health care, or what I now hear myself saying more of person-centered care that has to do with the person as a whole person, is that when we as a foundation are able to make grants in community, we look for organizations, nonprofits. We fund only nonprofit organizations, 501c3 or a fiscal agent. We look for nonprofits that do one of two things primarily. That is to improve the competency around cultural and linguistically appropriate care in medical settings. If any of your work is specifically to improve access to populations that has English as a second language or does not speak English, we do not ask the question of immigration status, our funding. What we believe is that all people deserve good health care. And so when we look to fund and partner with organizations, we're asking, are you an organization that seeks to improve the competence of provider systems around culture and language? On the other side of that coin, on the other side of our theory of change, and if I had a PowerPoint, I would click now and you'd see our theory of change come up the second side of it, which would be improving health literacy in diverse communities. We're in Palm Beach County. Miami-Dade County has already seen the influx of diverse populations. Palm Beach County is seeing a growing diversity, as our nation is. And so here in Palm Beach County, we are as likely to experience a person who does not speak English in many cases as we are a person who does. And though it is not, it's not an easy task to serve with great quality those persons who do not have English as their first language, or person who does not understand the culture of the American culture or Western medicine, it is, I believe, a responsibility both on the system and that person to get an understanding. And so what we do believe is that when we fund in community organizations that can help those diverse communities, those individuals, help them understand the system, the healthcare system. If your goal is to help diverse communities access the health system, because you know the uninsured, and I continue to hear the number of uninsured in Palm Beach County continually rising. If you work with persons, particularly persons of racially or ethnically diverse backgrounds, culturally diverse backgrounds, and you're assisting them in accessing health care, that's the kind of work that we seek to fund. Whether it's through promotores, programs where you're out in community working with helping people access, particularly in the Latino and Hispanic communities, working to help people access care in the community. You are in the community helping community people understand. Because here's something we do in Western medicine. We believe, and I just heard the presenter say before me, the build it, they'll come. We believe that if we have healthcare centers and hospitals, that sick people will automatically know to come. Not true. There are sick people in communities right now who don't know where to go, have no access to it, have no insurance, and don't trust the system enough to know how to navigate it. And so if you work with health navigators or promotoris programs, any of those programs that help individuals who do not have the knowledge of this healthcare system, we love funding those kinds of programs. Disease education, health promotion, these are the kinds of programs, again, that Allegany Franciscan Ministries will support. Now, keep in mind, we're a small foundation. Jillian, no, actually Leslie, one of you Jillian joked about me having loads of money in the truck, just the opposite. Unfortunately, our foundation, like many foundations whose interests are in the market, lost a tremendous amount of money last year in the market. Tremendous amount of money. I mean, the kind of money that only I can say out loud, but have no real concept of how much money that is. But we continued, our board made a commitment to continue to fund through these very difficult times, because if we as funders, and we are hit hard in the market, but if we as funders discontinue our work of funding, then how much more of a burden it would be on you as nonprofits. So to talk about our current initiative or our current funding structure is to improve access to what we call culturally competent health care. We believe that as you work with the system, providers, to help them understand the diversity of community, the complexity of the varying values and beliefs and norms in those systems that people present with every day, or if you're working within those diverse communities to help individuals understand the process of disease, to understand wellness, to understand the system and how to navigate the system, and to actually assist those individuals by taking them into the system, then those two are our primary priorities for funding. I will say this, over the last year, you all right? Am I doing okay? You following me so far? Okay. Over the past year, what we recognized, as I know some of the other funders and investors have recognized, is that the times have changed. The economy has worsened, and the need for basic services like food and shelter, as well as access to basic health care, increased. So in this past year, what our board agreed to do was to expand our funding focus to include access to food and shelter. And as a matter of fact, we were a part of it. I'm sure if you've already mentioned the Safety Net Fund, but we were a part of the Safety Net Fund because it was a way that our foundation could leverage funds to improve the access to those basic needs like food and shelter. Now, I do not know if we're going to continue with that expanded focus for 2010. As it stands, the board will meet in December to determine where we will go with that. But I will say for 2009, we did include that as a part of our funding structure. We have 3 grant programs. Write them down. We have our major grant fund. I'll talk to you just briefly. Tau grants, T-A-U, Greek letter Tau. The Franciscan sisters adopted the Greek letter Tau. It represents Francis of Assisi, which is who is actually the saint that the sisters follow. The major grant, the Tau, and then we have capacity building scholarships. All right. So let me tell you about those real quick. Major grants were closed for the year, but that's our grant program that grants will range from anywhere from $100,000 to $250,000, sometimes $300,000. They're multi-year in their structure. It's an invited process. You may submit a 2-page pre-application. Again, this won't start again until January of 2010, the major grant process. Check our website for that information. But you submit a 2-page pre-application. After the pre-application, our local commission, regional commission, will review those and invite you for a full application if your work and our priorities are a match. But that's major grants. But again, those are closed for 2009. The Tau grant, we still have opportunity in Tau, T-A-U grant. Those are grants that are up to $10,000. And again, the focus is healthcare, but we don't follow as closely that theory of change around provider competency and diverse community and health literacy. So in the Tau grant program, we may do things like health fairs or some other health more broadly defined. I mean, I'll be honest with you, we actually funded, and I thought it was a great opportunity for baby wellness, we actually funded cribs. Babies needed a safe place to sleep. We found that many of the families were putting babies in dresser drawers, pulling the drawer out at night and just lining it, and babies were sleeping in dresser drawers. So we've funded baby cribs out of the Tau grant. And so then finally, our capacity building scholarships, We also believe that the capacity of the nonprofit sector, in addition to the health system and the individuals, the capacity of the nonprofit to provide services is important. So we have what are called capacity building scholarships, and we have, I think, quite a few dollars left in this. Any of you, regardless of your nonprofit work, if you desire to attend a training, a conference, anything that will build the competence of your organization, the skills of your organization, your staff, or even some of your volunteers, we will fund up to $500 per person, up to 2 persons per organization. We will fund, just simply send in an application, we will fund up to $500 for you to attend any capacity building opportunity. So with that, Major Tau, our capacity building scholarships, that's what we do, that's who we are. I apologize for you being here so early at 9 o'clock. But again, thank you. My name again is Eric Kelly with Allegany Franciscan Ministries. All right?